Hey, deserving listeners, couples therapy. Let's watch.
The other person can't give.
Okay, well, I want to hear that. I want to hear the two of you try to figure that out.
We did this last week. Let's not, we did.
So how can I help you with that?
Okay, so he's resisting, and maybe for good reason. You know, often resistance is seen as a problem with the client, but, you know, sometimes the therapy isn't, you know, great, or it's not well delivered or something. So there's that. Oh, there's a raccoon. That's a big boy, big raccoon. Usually raccoons are at night, right? But this is, you know, in the middle of the day. It's really hot today in Seattle, so maybe it's because of that. I don't know. Anyway.
Look, the fact is that Jessica, and I think a lot of it is valid and understandable, is fucking furious with me existentially. And has very, very, very little rope to do anything other than grit her teeth through what I'm going through. She doesn't want...
Yeah, so Dr. Orna is like, wait, that's exaggeratory, but I think that's how he feels. And I think that this intervention is good, but I don't think it's going to work, because you can't tell someone with that amount of trauma and lack of developing to just develop. They don't understand. You know, you talk to a 12-year-old, and I've had those conversations where you are trying to help them to understand the logic of why things are happening the way they're happening to them, and they just haven't lived enough life yet. They haven't been given the opportunity. So although Boris might look and talk and walk like an adult in some emotional ways, attachment ways, he isn't. So he is being asked something that, even though I think he understands, it just doesn't compute. And even if it did compute, it would be an impossibility. But it's a good intervention to at least test the waters and maybe set the stage. And at the very least, it would validate Jessica. I'm guessing Jessica is eating this up right now, which is another thing to think about in couple therapy, is that although you're working on Boris, a lot of therapy could be happening to the other partner. You know, well, anyway.
Want to deal with this. She doesn't want to hear about it.
What does it mean to deal with it?
It's just with real soul and heart. Just be like, love, this is a catastrophe for you. Like, in terms of personal identity and self-worth or purpose, whatever you...
Yeah. Now, I will say that the way Boris is talking right now isn't dysfunctional. What he's asking for, I think Jessica knows what he's asking for, which is this ridiculous notion of impossibility, that she can never, no matter how hard she tries, she can never give enough and be enough for him in this way. But in terms of his words, I'm encouraged, because I think that he is listening to himself talk sometimes in session and realizing that there's some valid parts of it and some invalid parts. And he is talking about the valid parts, which is, I just really, really want... What he's talking about, he just really wants, like, severe, convincing validation and love and warmth and understanding, attunement. And yeah, of course. But it's way more than that. And I think Jessica knows that even if she were to be attuned in the way that a very warm therapist wife would be, it's never good enough. And it's constant, right? It's in the middle of her workday, you know, that kind of thing. It's selfish from him. And I think that's why she's reacting right now.
Why is that your reaction?
Because I have done that. I've done that. And you do not feel that it is enough.
Can you open yourself up to the possibility that you haven't?
All right, let's just take a little break here. The rest of this video will be for members of the YouTube channel. So if you're watching this, you're not a member, and if you become a member, then you get to see all of my stuff. I think there's hundreds of videos that are only for members. Otherwise, please take care of yourself, because you deserve it. You really, really do.